I'm Sue Rabati, and I started MedShadow Foundation about a year ago in order to explore and educate consumers about the side effects and the long-term effects of the drugs that are prescribed to us. Today we're going to be talking with Ray Murphy, who's a registered pharmacist.
Hi, Sue.
Hi, Ray. Thanks for meeting with us today.
Well, thank you for having me.
What happens if I forget to take a pill? If I miss taking one of the...
The best thing to do is to ask your pharmacist. Some drugs, it's hazardous to double up on the next dose, and other drugs you don't want to miss the next that next dose either. So it depends upon the drug and the person. So it's best to ask your pharmacist.
What if the pill is hard to swallow? Can I crush it and put it in applesauce?
It depends upon what the pill is. If it's pre-scored by the manufacturer, generally you can.
Pre-scored means has that line down the center?
Yes.
Okay.
Then you can split the tablet in half.
Whenever I get a prescription from the doctor, it comes with this piece of paper that unrolls to about this size and has a ton of side effects on it, including death in most cases. I mean, it just sounds horrible. How likely are those? I mean, I just ignore it, figuring my doctor would give it to me if it's going to kill me. But it does worry me. How do you know how likely those side effects are?
Once again, you're referring to the package insert that you get with the drug. And also, once again, it's best to ask either your doctor or pharmacist the percentage of likelihood that something like that will happen. They'll be able to inform you best.
To your knowledge, is there any percentage of people who have that side effect in order for it to get on the package insert? Is it 1 in a million so it gets on the package insert, or it has to be 10%?
That information is actually in another item, which is the physician's package insert, and that percentage is referred to in that document. So if you ask your pharmacist, they can actually tell you what the likelihood of that side effect to occur.
Huh, cool, thank you. What about supplements and medicine? What if I take vitamin D every day? Does my pharmacist need to know that? Does that have a drug interaction?
Yeah, you should, actually, when the doctor is prescribing something for you, you should let the doctor know all the other medications, including supplements, that you're taking. And in addition to that, you should try to have the medication filled at the same pharmacy all the time, because they have a list and a record on the computer of everything that you're taking. As far as supplements are concerned, there's been some concern about them because not all supplements are the same. The fact that they're not regulated by the government is an issue, and we really don't know what's in all these supplements.
So instead of taking vitamin C when I feel a cold coming on, I should just eat a ton of orange juice?
No, you can ask your pharmacist. I think that's the best thing to do when you buy it at the drugstore. And once again, I would rather someone buy a supplement at a pharmacy rather than one of the health food stores or the health stores. Because I think the pharmacist has the best knowledge of that.
Thanks. What if the package label says to avoid alcohol while taking a drug, but you only take it in the morning? Can you have a drink that night? How long do you have to wait?
Okay.
Not that I'm that anxious, but
right,
I like to know.
Right, we won't go into that, Sue. But just like alcohol and driving, alcohol and drugs are not a good combination. And in general, alcohol and drugs should not be taken together. Now, if you do happen to take alcohol a few hours before your next dose of the medication is due, I would ask your pharmacist if it's a safe thing to take the next dose. And if the pharmacist or the doctor is not available for that question, I would err on the side of caution and just skip that dose.
When does drug use become overuse? For example, you hear about people who become addicted to nasal sprays like Afrin.
Okay. Yeah, something like Afrin is, first of all, it's only intended to be used for 3 days. And if it's used beyond 3 days, then the person can develop what we call rebound congestion, where the more that you use the Afrin, the more congestion you're going to be encountering. That's a good example abuse with drugs or overuse with drugs. Another example is the class of antibiotics. Antibiotics should only be used as prescribed by the doctor. They should be taken when they should be during the day, and they should only be taken for the length of time that they're prescribed for, which is typically 7 to 10 days. Even if a person starts to feel better, say by the 4th day, they should complete the therapy with the antibiotics.
They say not to take antibiotics too frequently because you can build a resistance to it.
That's right.
Yeah.
That's right. They should only be taken, first of all, for bacterial infections. Some people might want to convince their doctor to order them antibiotics for a common cold. Common cold is caused by virus, and this is a good example of misuse of an antibiotic, which is only used for bacterial infections.
Mm-hmm. But if everyone's telling you to take as few antibiotics as possible, then why wouldn't I stop after day 4? I feel better. I'm done. Why would I take more than I need to?
Okay, I'm sorry. Because the bacteria is still in your system, right? And even though it's gotten to a manageable level where you do feel better, it can grow back. And that's why most antibiotic treatment is recommended for 7 to 10 days. Most studies have shown that during that time that the bacteria will be eradicated or destroyed.
What other questions do you get at your counter?
Well, you know, a big issue today is when patients come up to the counter and they ask about how to dispose of their medications. And this is both for over-the-counter and prescription medications.
Mm-hmm.
It used to be believed in the past that the appropriate thing to do was to flush them down the toilet. But now we've discovered that gets into the water supply. So what's recommended now is to pour the used medication either into used kitty litter or used coffee grounds. Put that in a container, seal it, and put it in with your regular waste disposal. In addition to that, what I might add too is that there are drug give-back days that are usually like twice a year, and people can find out about this by going on and Googling the government website, and they'll tell you the dates that you can give back your medications, and the place where you can do that too.
Thanks. Well, that answers my questions for today, Ray. Thanks a lot for all your answers.